Hey everybody, I'm Dr. Gaffney from Dr. Gaffney Bestfoot here today to share tips and tricks from my 29 years of experience as a podiatrist to help you get your best foot forward. So today we're going to talk about how do you get rid of ugly toenails, specifically those ugly fungal toenails, otherwise known as onychomycosis. So I do want to unfortunately burst your bubble as there's no easy treatment. This is one of the most difficult things to treat, and there's limited medications for it, and there's really none that I know of that are being developed. So do not believe all the social media ads detailing quick fixes. There's not. So we'll just go over different treatments and how you can be helped. But I do want to say that this is not intended to diagnose, treat, or prevent any disorder or disease condition. It's not intended to give you medical advice. It's for informational purposes only. This video does not constitute doctor-patient relationship, and you always must consult your doctor before pursuing any treatment or for any condition. So anyway, fungus is a little microscopic organism. It is everywhere. It likes a dark, moist environment, like your shoes. And if you have a trauma, it can get into your nail, and it likes to eat up the keratin of the nail, so the dead skin layer, your nail, and also on the dead skin layer on the bottom of your foot. And that would be like an athlete's foot. When it's on the bottom of your foot, when it's in your toenail, it makes that thick yellow nail. So it eats up the keratin, and it lays down these layers, and it's all this crumbly debris underneath your nail. And so it usually gets thicker and thicker instead of the nail getting longer. Most people notice if you have fungal toenails, your nails get thick instead of long. So how does it happen? Usually a big proponent is genetic predisposition. So basically how much you're sweating. So if your feet sweat a lot, it just creates that moisture, and the shoes make it worse. You're in that dark environment. And so that's a good fungus incubator. It needs a trauma to get in the nail. So you have to stub your toe, something fall on your toenail, and the fungus that's everywhere gets into your toenail. It does not matter how clean you are. You can't get rid of all the fungus, just like you can't get rid of all the bacteria. It's just part of our environment, and it's on our skin too. Some of the things to be wary of that might increase your chances to getting it would be leaving toenail polish on all summer long. Toenail polish kind of creates that environment. It traps, if you have some contamination of the fungus, the toenail polish creates that dark environment, traps the fungus. So I've noticed in some of my patients, like you take off their toenail polish and they've got this white discoloration. That is yeast, and luckily a lot of that just sits on the nail, and you can just kind of sand it off of there. But sometimes it gets in there and it creates that thick yellow nail that's hard to get rid of. So toenail polish, and also when you get a pedicure, tell the pedicurist not to push back that cuticle. That cuticle is there to keep bacteria and fungus out. You don't want to push that back and let that get in there. You can get bacterial infection or the fungus. And pedicurists tend to get real aggressive around the nail and scoop all that stuff out of there. You can create little micro traumas there where it gives an opportunity for that fungus to get in. So you just have to have them chill out with that. Fungal toenails are more prevalent the older you get, because there's more opportunity to have trauma to your toenail. Also, diabetics, immunosuppressed people, or people receiving chemotherapy tend to have onychomycosis more. So how's it diagnosed? It's mainly a clinical diagnosis. So the thick yellow crumbly nails, most podiatrists can look at your toenail and know that you have onychomycosis, and most lay people can too. It's fairly obvious, but there are some other things that mimic it, like psoriatic toenails. Sometimes you can even have like a cancer of the toenail, even like a melanoma of the toenail, which is a skin cancer. But those things are rare. They're like single-digit percentage, and most podiatrists probably could discern it, but you should have a confirmatory test of your fungal toenail before pursuing treatment. Many times doctors don't do that, and it's kind of obvious if you have onychomycosis, and they go ahead and treat it without the diagnosis. Some insurances require it. I found that the testing is somewhat inaccurate and kind of gives you a lack of clarity. There's a lot of false negatives. I think the main reason for that is poor sampling. To get a proper sample, you have to go underneath the nail plate where it's kind of lifted off the nail bed, and you got to get to the point with the healthy nail and unhealthy nail and kind of get all the debris there. And that's kind of hard to get. Sometimes you would even have to numb it up to get down in there to get a proper sample. But there's 3 types of tests. There's special stains, which is less expensive. There's fungal culture, which is more expensive, and a preliminary chain reaction, or PCR, which is the most expensive, hundreds of dollars. So KOH is probably the least expensive, and let you know you do have a fungus, but it doesn't ID the organism. Anyway, how do you treat it? It's difficult to treat. There's some prescription topicals, and there's 3 mostly used. There's Penlac, Keratin, Jublia. Penlac is the least expensive. Jublia and Keratin are extremely expensive, hundreds of dollars. And normally they are only effective for the fungus that affects like 10 to 20% of the nail out at the end. You got to use it for 48 weeks every day. So that's almost a year. And so I think that's where people, don't do well, and it doesn't work for them because you have to be diligent. 48 weeks, you got to keep your nail trimmed back. So that's that. And there's a low percentage of clinical cure rate, which is clear nail. So it's like probably under 20% clinical cure rate. And I think that's mainly because it's hard to just do that for the 48 weeks, and it's hard to be diligent that long. If you have more than 10 to 20% of your nail infected, I normally tell my patients to get on an oral medication if they can. There are some drug interactions with these oral medications, and there's you have to check liver enzymes. So the 3 medications are diflucan, which is used off-label, or it's not FDA approved for onychomycosis, but a lot of physicians use it for candida type onychomycosis. There's also Sporanox and Lamisil. The one that's most commonly used is Lamisil, and that's the brand name. It's terbinafine. It treats the dermatophytes, or the skin-loving organisms. So that's the most common type of bug that'll affect your toenail. Lamisil is fungicidal, so it kills the fungus. So that's the one I usually use because it kills the fungus. The Sporanox has a little more drug interactions. It's kind of difficult to use, and plus it's fungistatic, so it just inhibits the fungus, doesn't kill it. So that's the main reason why I rarely use Sporanox, but sometimes I will. It seems to be better for certain molds, if you get certain molds that grow out in your culture, than the Lamisil. Diflucan is used off-label, like I said, and it's mainly for yeast and candida. Now, the problem with these medicines is they've been out for a long period of time. There's resistance beginning to develop, and I think that's one of the causes of lack of success, or failure of the medicine, or even recurrence. So, and we don't really have any new treatments down the pike. There's no other medications other than there's a couple. There's voriconazole that's used more for molds, but that's another one that could be used. So those medicines are taken for toenails. You take them for 12 weeks. You got to take them every day. If you miss a day, it's probably okay if you miss 2 days. I usually have my patients start over again. You have to get liver function studies. I usually have my patients have a baseline and then check them in a month. If I notice any elevation in the liver enzymes, we stop the medication, usually reverts back to normal, but there is a 3% chance of elevation of liver enzymes, rare chance of liver failure with these medicines. So they do come with risk. So that's why you have to work with your doctor and make sure it's safe for you to take. There's drug interactions as well. So you got to make sure it's safe. And like I said, work with your doctor. But yeah, when it comes to, like, if you have any history of liver enzyme elevation, fatty liver disease, history of alcoholism, or just heavy alcohol use, I would not recommend going on the oral medications. I think your liver is more important than clear nails. So while you're being treated, usually I have patients put on the topical at the same time, because it takes a long time for the nail to grow out. It takes like 6 to 12 months for the nail to grow out. And as it's growing out, you still have the fungus out at the end. So the medication will treat the fungus at the nail root and the nail bed where it's living. And it's still, it's still there growing out. So as it grows out, I usually have patients just put the topical on there so you don't get another trauma and have it reseat back in your nail bed and your nail root. So I like to treat it top down, inside out for the best possible outcome. Also, you got to let your feet air out. Maybe change your shoes. There are some shoe sanitizing devices. Pedifix, I believe, sells shoe sanitizing device. Expose your feet to UV light because it kills fungus, but you got to be careful not to burn your skin. So maybe wear sandals more often while you're treating this. And the other thing is you need to keep the nails kind of trimmed back. So keep all that loose stuff trimmed back. You don't want to get over aggressive. Just anything that's loose, just keep it cut back. Don't hurt yourself. Don't dig into the nail bed and cause another infection. Okay, and lastly, a question I would get a lot is, can't you just remove my nail and the fungus will go away? No, you can't. Like I've been saying, the fungus is in the nail root at the base underneath the skin there, and then the nail bed. So it's living there. You take off that dead tissue, the nail, and the nail root is going to produce the fungal nail because that's where it's living back there. So the only time I would remove a toenail for toenail fungus is if we get a failure with the Lambda cell. They will retest to see what kind of organism you have, see if you have a mold in there. We might have to switch to Sporanox or voriconazole, and then find out actually for treating the right bug, and have the patient go back on the orals and do topical at the same time as they're healing from their toenail removal. But so that's the only time I would do that for onychomycosis, is if there's a failure. And then prevention, just trying to keep your feet as dry as possible. Maybe changing your shoes out, Lysol your shoes, expose your shoes to UV radiation, get that sanitizing device. That might be helpful as well. Don't let your toenails get too long. When the toenails get long, it'll catch on things, gives like a little opening for the fungus to get in there. Don't let your pedicurist push back the cuticle like we talked about. And just try to protect your feet from trauma, which is sort of hard to do. But if you do have a trauma, I usually use tea tree oil when I have toenail trauma. Now, tea tree oil has low-level evidence of antifungal properties, but I've found that it's been helpful. I've had some superficial white fungus on my nail, and I sanded it and used the tea tree oil, and it did fine. But that's anecdotal. I'm just one person. So there's Vicks as well. There's low evidence of Vicks helping. Again, it's the same as a topical. It would probably only help you for the little bit out the end of your toenail. The tea tree oil, and there's also laser. Laser has low evidence for helping, and it's extremely expensive. Insurance doesn't cover it. I like those topicals, those prescription topicals I talked about, Jubilee Keratin. The Medicare, I don't think, covers it, and they're hundreds of dollars. It's very hard to get care for this because it's expensive. If you do want your nails to look nicer, you can use what's called Carousel. They sell that at Walgreens, Walmart. It helps to keep that thick nail down. That would be helpful. If you really like toenail polish, I would recommend an antifungal toenail polish, just so you're not trapping fungus in there. There are antifungal toenail polish types on, I believe it's Amazon. So, and that's all I have for you. Not great news, but I did want to lay it all out for you so you don't go down the wrong path after these quick fixes that don't work. Hopefully in the future we'll have something that helps better, but I sorted out it. But that's what we got. And good luck with everything. If you like this episode, like and subscribe, and leave me any comments. I'd be happy to help you. And thanks for watching.